very good morning to everybody. I'm Dr. Kavya Somesh, consultant physician and a diabetologist at Joseph Hospitals in Kilpog. And today, on account of the World Hepatitis Day, I would like to clarify a few points about hepatitis infection. So, what is hepatitis? Hepatitis is an inflammation of the liver. In simple terms, when the cells of the liver start swelling, the problems associated with the liver problems flare up. So this is a very serious condition. It can be fatal in certain persons. So what is hepatitis due to? Hepatitis can be due to hepatitis A, B, C, D, and E. So out of these, the most fatal is hepatitis B and C. All other infections can be managed by vaccinations and proper care. So what are the symptoms which are associated with hepatitis infection? So first, what is hepatitis A? Hepatitis A is usually transmitted through contaminated food and water. For example, when a patient is affected with hepatitis and they are not using the proper hand washing techniques, then their fecal or oral matter can be a source of infection for others. Second thing is hepatitis B and C. So both of these infections are transmitted through sexual contact, and the second one is sharing of infected needles among drug users, and third one is sometimes in pregnancy from the mother to the child. And these hepatitis and B, all these hepatitis infections mostly cause fatigue, and the patients also have stomach upset, diarrhea, abdomen pain, nausea, vomiting, and these are the most common symptoms associated with hepatitis infections. Whereas hepatitis D and E are also transmitted through body fluids. So how do we prevent it? How do we go about treating this condition? Because there are over 4.5 million premature deaths which are happening in the worldwide because of this hepatitis infections. So how to prevent these premature deaths? We have vaccinations, we have proper treatments, we have proper diagnostic methods. So when a patient presents to us with all these symptoms, we screen them for hepatitis B, C, and if necessary for the hepatitis A, D, and E infections. And we administer them vaccines if they are not infected. And if they are infected, we administer treatment at the appropriate time. So as patients, what you should do and you should not do. What you should do is try washing your hands, try keeping a very personal hygiene to a maximum. And this hygiene is very important when you're washing hands after and before using the toilet. And the second thing is don't abuse any alcohol or smoking. And third thing is using among the injection and drug abusers, avoid these injections with sharing of common needles. And fourth one is proper blood transfusion at the proper place. And improper and not personally purified blood samples also could be a potential transmitter for this viral infection. And proper hydration, proper food intake, and then proper immunity is all very important to avoid infections. And the most important is the vaccination. Vaccinate yourself for hepatitis B and C to prevent the most fatal infections, which is hepatitis B and C. And what are all the don'ts? You cannot share common razors, common needles with the infected person. And second thing is avoid body contact with the persons with the like saliva and the body fluids from the infected person.